neurotransmitters, those ligands, responsible for making the neuron more prone to hyperpolarization, we call them inhibitory. So let's stop by at those abbreviations here. Excitatory versus inhibitory. Excitatory neurotransmitters, and the representative, for example, is glutamate, the major excitatory or even excitotoxic neurotransmitter in our central nervous system, glutamate. In contrast to inhibitory neurotransmitters, and the major inhibitory neurotransmitter is GABA, gamma amino glutamic acid. Gamma aminobutyric acid, GABA. But also serotonin is inhibitory. So what is important here for proper functioning of our brain is a balance between excitation and inhibition. So the balance mostly between glutamate and GABA is extremely important for proper functioning of our central nervous system. So please note that. Okay, that's all about the excitation. Maybe I will add here, because it's also important. Glutamate receptor is, perhaps you know it from physiology or from biochemistry or whatever. It's a very complex structure. It contains several binding sites, mostly for glutamate, of course, but also for AMPA, for kainate, and most of all, NMDA, N-methyl diaspartate. And this binding site, together with NMDA, is heavily involved in drug dependence, in pain transmission, and in memory formation, because it's excitatory. So you should remember glutamate, but also NMDA. Okay, that's all about the neurotransmitters, classical neurotransmitters, glutamate, GABA, serotonin. You definitely know the story about classical neurotransmitters, but we'll also, at the end of this presentation, we'll be talking about atypical neurotransmitters, which you perhaps are not aware of. So it's good to at least to know what's on the in our system. But now we'll switch to, let's say, rough anatomy of our brain. We have two hemispheres, okay, left and right. That's clear for us. The left one is more, let's say, mathematical, and the right is more artistic. We are not going into details who has better developed left or right hemispheres. It doesn't matter, at the moment at least. Definitely, as a candidate for physicians, you should have left hemisphere well developed, but also the global holistic thinking is also a feature of all good physicians. So you have a good balance between those hemispheres here. Nothing is, the equilibrium is not shifted to any side of our brain. Anyway, what is important for especially left hemisphere? Spoken language. Left hemisphere with Broca area is responsible for spoken language, for speaking, for naming things. This is the pen, this is computer, this is Apple, whatever else. And right hemisphere is more responsible for art awareness, for creativity, for face recognition, for example. So it's more holistic. And of course, the left hemisphere controls the right side of our body, and contradictory, right hemisphere controls the left side of our body. That's obvious. Okay, that's a summary here. You should have this slide uploaded. So the major difference here between left and right is this spoken language, naming things, because this is of our interest for future, for next slides. Okay, majority of people, if they suffer from language disorders, majority of people will have a problem with the damage to the left hemisphere because this Broca area is located in the left hemisphere here. Before the imaging technology, neurosurgeons were using some WADA test to eliminate any problems with the, let's say, too much surgery done to the left hemisphere. So just to make a surgery without distracting Broca's area. How this was performed? Sodium amytal, very short acting barbiturate, has been injected into carotid artery just to block entire hemisphere. Once you block entire hemisphere, you switch off everything that is controlled by the hemisphere, left or right, doesn't matter. And because of majority of us has this center located in the left hemisphere, so they always started with the left one. That's a scheme. It's not used anymore, but I am just showing you how does it work. So that's the injection site, etc. It was active, this barbiturate was, let's say, active for half an hour. It's an unpleasant, of course, it's short acting, but anyway, it's a very unpleasant feeling that you have everything, all functions controlled by the left hemisphere, just eliminated. Okay, so that's how they confirmed which hemisphere contains this spoken language center, Broca's area. Okay. Now we'll jump a little bit. The link between brain and personality or our behavior. We talked about that. Okay, so I just returned just to show you a few more slides about that. And this you remember as well. This was a young fellow who donated. He was sentenced to the death for murder, multiple murder, and he donated his brain. So it appeared that he had a tumor, just pressing area between thalamus and amygdala, and that was perhaps the reason he went on rampage. But now we are coming to the ethics. Well, it was a sort of disease, a serious one. So we can say, okay, my brain made me to do it. Is that an explanation? So we should escape the penalty or punishment? Definitely not. Because even if the cause of the act can be explained in terms of brain function, the person who committed such an act cannot be just left innocent, exculpable. So the person is still responsible, of course. But the final decision belongs to the court, of course. And you don't have this slide uploaded. Well, just a brief slide about the free will. What does it mean, the free will? That we feel, okay, we can do whatever we want. We can steer our thoughts, and we can do, in a moment, I can join the lecture on, let's say, neurodegeneration, or I can do something else. I can watch TV, whatever else. The problem with the free will remains to be resolved by philosophers, but the statement here makes it crystal clear. There are perhaps neuroscience, maybe philosophers will, but not a neuroscience at the level, at this level of development that we have, or progress. The neuroscience will never find the brain correlates of responsibility, as this is exclusively ascribed to humans. So we don't have any good model. If we have had the animal model of morality, animal model of free will, then okay, we can try to study the mechanisms. But we have only humans, which means that we have to await, let's say, different specific medical cases with some accidents, like Phineas Gage, for example, or this fellow who committed murder. We don't have any other tools to study the free will. Okay, we talked about Phineas Gage. Did we? Could you please send me the brief information? Did we talk about the Phineas Gage here? Yeah, okay. So you know this, no longer the gauge. So this was this is one of the best described medical case, showing clearly the link between an injury to the prefrontal cortex and personality. I guess we stopped at the lobotomy, so people continued this conclusion from the Phineas Gage case, and they introduced lobotomy for treatment of something that at that time was completely incurable, like schizophrenia, depression, anxiety, seizures, epilepsy, etc. So lobotomy was based on just mechanical distraction, random distraction of a part of prefrontal cortex. Who designed this method and introduced? He was physician Egas Moniz, Portuguese. And he received the Nobel Prize for the method, which didn't help to the people, but it made a lot of traumas among those patients who were treated using lobotomy. So there are many people just applying to the Nobel Committee just to withdraw this Nobel Award from Moniz, but of course it doesn't work. And Moniz is honored in Lisbon. In Lisbon, there is a huge hospital named by his name, and there is also the monument, as you can see here on this slide. I will make it a little bit larger here. So his monument is here. So he is very much honored in Portugal. This method has been improved by American Walter Freeman just after Second World War. So he used the ice pick method, and the ice pick, it's like, do I have it here? No. Ice pick is something metal piece to crush the ice for bourbon, for drinking bourbon mostly, or for some soda drinks like that. So he used that and randomly destroyed the prefrontal cortex, at least partially. At that time, there were no neuroleptics. And then they finished this. They never continued. It was continued in Scandinavia. It was continued. Lobotomy has been continued till mid 60s in 20th century, but it was also continued everywhere in the world until development of first neuroleptics, tricyclic antidepressants here. Okay. Here we have another, we'll be talking about this, about art forgeries, and Van Gogh, of course, has been faked by many forgers, but this is a later presentation. Here is Dr. Gachet, who was a general physician and also protector and sponsor of many artists in the Van Gogh's era. And Van Gogh made a portrait of this Dr. Gachet. He was psychiatrist, and you can see he suffers from severe depression as well. So he has been depressed very much. And Van Gogh, self-portrait with bandaged ear. He cut off his own ear after having some arguments with his friend, and also great artist Gauguin, Paul Gauguin. So this behavior changes, and perhaps the behavior, we don't know exactly what Van Gogh was suffering from. We have some suspicions, but we don't know that. But most probably also those vapors from organic solvents used for just dissolving the paints or pigments were contributing to his overall health state. Well, that's a little bit philosophical conclusion. Who you are depends on where you have been. What are our experiences, previous experiences? What are our memories? Because everything contributes to our behavior. And because our experiences continue to change along our life, so our identity never reaches an endpoint. So we are just changing our mentality, our memories, etc., etc. And of course, when brain activity stops, so do we, because we cannot proceed with our development. We can be still alive, our body is alive, but that's again ethics and completely different course that you also have on the list of electives. We know that brain in general does not show any neurogenesis. That means production or development of new neurons. We knew that until November 1998. Because at least in hippocampus and olfactory bulb, we have some stem cells leading to production or to the growth of new neurons in adult humans. So that's very important observation. At least in those structures, we have possibility of neurogenesis under adult life, of course. What is responsible for that? Which agents? Neurotrophins. Neurotrophins, which contribute to the growth of the new neurons. But here we have some bad news. Neurotrophins do not cross the blood-brain barrier. So any development in this direction with pharmacology to stimulate the neuronal growth will not work because they don't cross blood-brain barrier. And the only way to stimulate neurotrophins that we all have in our brains is to exercise our brain by studying neuroscience, for example, neurodegeneration, by studying endocrinology, surgery, whatever else, art, many other things. So the neurons is growing till it reaches maturity. So that's on the growing cone. So it protrudes this, axon to connect to other cells. But what is controlling this growth, elongation of the axon, and what is controlling the site of connection with other neurons? We have two groups of agents, chemical agents, attractants and repellents. Attractants, the green one group, and repellents, the reddish one group. And whatever else is inside the cell, whatever. And this is like the elongating axon will detect attractants and repellents. So it follows attractants and avoids repellents. So that's the trial and error method. That's how it works, elongation and connection to other neurons. Another bad news, when we are adult, so in general, the mass of our brain, that means the number of nerve cells in our brain, decreases constantly in a normal, healthy brain along our age, when we are aging. We are not talking about neurodegeneration yet. Okay? So the age when we are starting to lose something is around, let's say, 25. Does it tell you something? That was a bad news, but fortunately, it's a very slow decrease. Okay, this we can skip. One more very important issue. This is what I was talking about, perhaps in the previous week, in the previous lecture, but one important statement here, one important observation. Those neurons who do not develop any connection to other neurons will die because they are not necessary. And whatever is unnecessary in the brain or in our body simply dies. The cells must have a company. If they are alone, they die. And this is valid for any cell in our body. It's also important introduction to neurodegeneration. So please remember this only. The complement cascade activation, inflammation. Inflammation, this is a quite new observation 4 years ago, done 4 years ago, because this complement cascade activation regulates synaptic connections and plays a role in neurodegeneration. So this is a brief introduction to what we will be talking about perhaps next week. So inflammation might be a key factor in brain neurodegeneration. I would rather say it's one of the important factors, not a key factor. But inflammation is also linked to cancerogenesis, for example, as well. Okay, when we are losing those nerve cells, we shouldn't be afraid too much of that. Why? Because it's possible to reprogram glial cells into functional neurons. So there is a future. So maybe this is a strategy, future strategy to repair the brain, for example, after a stroke or the spinal cord after some injury. Okay, I will skip this. That's too much biochemistry maybe for you right now. This is something important, also from the point of view of students and also teachers. Exercise produces new neurons, initiates this neurogenesis in hippocampus and olfactory bulb. And here is the experiment using animal model. The left cage shows the two rats that are totally bored, lazy, they have nothing to do, no challenges at all. And below this cage, you see the drawing of the neuron, how it looks like. There are no branches, or there are very few branches which should be present to connect to other neurons, to make connections to other neurons. And the right side cage, shows the rats that have some challenges, mostly intellectual, but also like maze, for example, but also physical challenges. And have a look at this scheme of a neuron with much more branches. So that means much more possibilities to connect, to make connections to other neurons. Okay, that's the neurogenesis. And here you see those red and orange dots in the right-hand scheme or picture shows the new neurons. That will be present only in this cage where those animals have something to do. You remember the slide that I mentioned that those neurons who do not develop any connections to other neurons, they will die. And that's what happens when we are very young, after birth. We undergo different stimulations. We have new challenges. We have new situations. We find ourselves in completely novel situations and forget what was just in the past. You remember that children don't remember what happened just a couple of minutes ago. And those neurons who are no longer necessary, they will lose connections to other neurons. That's why we do not remember anything between year 0 after birth up to third year of our age, at least up to third year. Because those connections are already gone. But this points out a very important conclusion. That we are losing memory traces by losing neurons. We'll continue this in a moment. Please remember that. Okay, now to the point. Here, the left side, left scheme, is just the axon with several synapses without any exercise. And here, at the right side, we have the situation just after starting the exercise. So you see that there is stronger synaptic connection to potential other neurons. Here is another drawing. Before experiment, 5 minutes before experiment, we have a situation control state. 3 minutes after the experiment started, that means the rats started to use the wheel, tried to find the food in the maze, etc. So you see this potentiation in synaptic connection or synaptic strength. Now the bad news is coming again. 16 minutes after the experiment has been terminated, everything starts to coming back to normalcy, to basal state. You know this situation? 3 months summer vacations. You return after vacations in October to the medical school, to the university, and you forgot everything. So that's why. This is the explanation of the situation that you suffer each year. There are two important factors to stimulate the brain: learning, which will stimulate synaptogenesis and also neurogenesis, and the physical exercise that stimulates angiogenesis, which also provides more blood, more nutrients, more oxygen to the brain, which also contributes, and those both, learning and exercise, contribute to neurogenesis. Very important. So it's not only that you will be sitting and reading the books trying to memorize neuroscience, but also that you will do some jogging or tennis playing or whatever else, or just simply walking with a mask. What are the agents? Can we make some or develop some pharmacology to stimulate neurogenesis, or at least to stimulate our brain to be more efficient? First, start with some, let's say, natural agents that will inhibit neurogenesis. Opiates, heroin, morphine, alcohol, in larger quantities, just to make it clear. Nicotine. We'll talk about nicotine when talking about Parkinson's disease, because nicotine has some protective effect. And cocaine. There is only one group of substances that is really beneficial: cannabis and marijuana, of course. Yeah, I hear this laugh, or at least smile. So cannabis, the only illicit substance that promotes hippocampal neurogenesis. But have a look at this experiment that has been performed on experimental rats, on laboratory rats. When the dose of cannabinoids in the lab, you can dose exact amount of the substance, of course, which you cannot do in a real life. But we'll just come to this point as well. So when the dose is too low, nothing happens. There is only very narrow range when cannabis really stimulates neurogenesis. When we go further and exceed this dose, then we have a dramatic decrease in a hippocampal neurogenesis, leading even to the loss of neurons. So now imagine the real situation in real life. We take a joint, we smoke the joint. For the first, we don't know how much cannabis it contains. For the second, we don't know how much will go through our lungs to the brain, maybe less, maybe more. So we don't know anything. And we may, of course, increase the dose because the present concentration of cannabis in the joints is very high or might be very high. And having in mind the potential benefits of having some slight effects of neurogenesis, which may not contribute to our learning capabilities, and at the other side, all negative consequences of smoking joints, because there are negative consequences as well, like psychosis, for example. So it's better to not to use it. We talk about the cannabis a lot and benefits and drawbacks and potential harms. We talked during second course, which is neurobiology of drug dependence. It will be in the next semester if you are interested in. It's also elective. Another group of substances that contribute to the neurogenesis, antidepressants, like Prozac, for example. That was a good news. The bad news is that, of course, antidepressants also show some negative consequences. And antidepressants do not work or do not contribute to neurogenesis in healthy adults, which do not suffer from depression. So if you don't suffer from depression, don't even take it. Okay. Some critical cases. We were talking about hemispheres, left hemisphere, right hemisphere. And in case of some intractable seizures, there are like 50 cases a year around the world where the only treatment is hemispherectomy, removal of one hemisphere, or at least part of the hemisphere. Intractable seizures. This is the drastic way, of course. So the what is left under the skull will be immediately filled with the cerebrospinal fluid, and the earlier the surgery is performed, the better for a patient, because some functions, usually it concerns the left hemisphere. Some patients, the younger the better, may have a possibility that the right hemisphere will take over at least some of the functions of the left hemisphere at early stage of human development. You may just make, this is the girl, it's the YouTube film where you can see the young girl that underwent the such hemispherectomy, and she behaves in a quite normal way. Just make a screenshot or make a picture so you can see how it looks like. You should have it uploaded on the server. And here we approach something that we call neuroplasticity, the ability or capability of brain to remodel. We are not talking about the shape, like shape is plastic or the brain is plastic, so we can make from the sphere, we can make a square, for example. No, that's not the neuroplasticity. It's remodeling, which means changing connections between neurons. So this is the ability of the brain to change for better or worse, of course, throughout the individual's lifespan. That means we are constantly changing connections between nerve cells. So changes in neural pathways and synapses. This also compensates for changes in behavior, environment, neural processes, and changes also from bodily injury. Major conclusion: the brain does change throughout life, which means connections change. And they change quite fast. So when you are learning, while you are learning, for example, listening something and memorizing what we are talking about today, when we'll finish today's lecture, today's meeting, your brain will be different from the brain we started today at 10 o'clock sharp. Okay? So that's what happens when you learn neuroscience, for example. Today also. So neuroplasticity concerns this functional reorganization, changing connections. As the brain develops, certain areas of the brain become specialized for specific tasks. And if our experience changes dramatically due to the damage of the brain tissue, for example, stroke, accident, whatever, the areas previously specialized for a certain function can take on the work of other areas. That's what I was referring to the hemispherectomy, for example. So there is no doubt that the organization of the brain is hierarchical. Okay? The cortex is at the top. Then we have this limbic system, this most primitive brain, midbrain, and the brainstem. The most complex, of course, is cortex, is neocortex. And then the most simple is the brainstem. It responds to the basic functions like temperature control, reward, etc., etc. And then we have sensory motor cortex, coming back to the among others, hemispherectomy, removal, whatever else. It's a tiny belt across the hemispheres. You have it painted here in brown, in orange. And this sensory motor cortex contains a lot of segments. It's segmented. Each segment is responsible for sensing and controlling particular part of our body. Each finger, tongue, lips, eyebrows, eyelids, toes, whatever else, which is represented here by this exaggerated little bit person, which we call homunculus. Homunculus. And to see what is the most sensitive outside our body: lips, tongue, fingers, and feet or toes. That's why it's a little bit overdrawn. Here is again the another drawing of the same, this homunculus. So you see eyelids, eyeballs, the fingers, hips, knees, ankles, toes. tongue, swallowing, whatever will be represented in this sensory motor cortex. Okay? If it is so, you may find such cases that a patient after surgery of a limb still feels, because of some problems, still feels the pain in a non-existing limb. We call it phantom limb pain. Usually, in majority of patients, this pain is gone after a couple of weeks or couple of months. But there are patients that still feel this persistent pain, and they feel this limb despite the fact that it has been removed, amputated. They also claim that they feel the wristwatch on the non-existing wristwatch on the non-existing arm, like that. So that's the phantom limb pain. Why is that so? We talked about that the functions of some destroyed parts of our body or our brain will be taken over by other parts. Not always is it so. You remember that the limb, each finger, etc., will be just represented in the sensory motor cortex. And those patients with this phantom limb pain cannot rearrange the sensory motor, those pieces, segments of the sensory motor cortex, which were responsible for the problem. They still remember the limb exists, fingers exist, and they still feel this pain. So that's the mechanism, how it works. And usually, if you see this picture that I am showing right now, you see what happens after amputation, for example, if one finger. So the sensory motor cortex, which was responsible, this segment responsible for this amputated finger, will be divided between two neighboring segments. So they will take over. And sensory motor cortex simply forgets about this finger, which is proper reaction of the brain. Unfortunately, in those phantom pain patients, phantom limb pain patients, there is no rearrangement of this sensory motor cortex. That's why. Is there any remedy? It is. We'll jump over because mirror box technique is no longer existing. Computerized systems. There are sensors that will be attached to the amputated limb, and then there is a software that adds the non-existing limb to this amputated. So you see how it works. Here is amputated in this fellow, and on the screen, on the computer screen, you see that the software adds this artificial arm or forearm, like that. And then there is a simple game that helps just to distract patient. And in that way, patient learns, or sensory motor cortex learns how to forget this non-existing limb. So it really helps. And here's the, after several sessions, you see that this method really helps those patients. Okay. We still keep up with those hemispheres. How they are connected? They're connected only at the very small surface. And the tissue connecting those hemispheres is called corpus callosum. You see it on the left picture, you see the tiny connection The rest is separated. So the only connection between those hemispheres is just small corpus callosum. What if there are such cases as well. What if we separate two hemispheres apart? That means we'll cut corpus callosum in half. Do we get two brains, like two processors in the computer? Do we lose functionality of entire brain? What happens? Here is an example. Of course, we'll survive, we'll function properly, or almost properly. But you remember what were the responsibilities of each hemispheres, right? The left hemisphere contains this spoken language, naming things. So let's have a look at the first left picture, left side picture. We have several objects, and the patient is focusing at the one selected object. Here is the hammer, okay? Hammer is placed at the left side of the person. So it will be seen by the right eye. Okay? When you ask the patient, what do you see? The patient says, nothing. Let's switch the situation or revert situation, the right picture. This is an apple. And the apple will be seen by the left eye and recorded by the left hemisphere. What did you see? I saw an apple. Why is that so? You remember, spoken language is located in majority of people, is located in the left hemisphere. There is no longer connection because we cut down the corpus callosum, we separated those hemispheres apart. So whatever stimulus goes into the right hemisphere, it cannot be named. So that's the effect of separating hemispheres. Interesting observation. Okay. This also leads to some other problems, like, for example, discoordination of both hemispheres. This has been a movie, Dr. Strangelove, and we have a syndrome, Dr. Strangelove syndrome, or a lion hand syndrome. It happens also to the patients with separated hemispheres apart. When one hemisphere, for example, tries to do something with one hand, and another hemisphere controls the other hand, which is doing exactly opposite. So it also may happen to such people. And we have those battles in the brain constantly or continuously, even if we don't have those hemispheres separated apart from each other. So this is like a perceptual B stability. You see both the rabbit and also the bird, and your brain cannot decide what do you see, or the brain sees, of course, because it's the brain and not we, but not us. Another important information also for students, but also for teachers. Attention or inattentional blindness. There is a very important and interesting, first of all, experiment on human volunteers. The volunteers were asked to play the basketball. When they were heavily involved in the game, there was a person dressed in the gorilla dress, you see it on the picture, that was walking back and forth simply. And then He vanished. And then after the game, those people were asked, have you seen something special or something unusual? No. They were so heavily involved in the game, they were they overlooked something that was also unusual here. So this is called inattentional blindness, which is important because here we have another experiment, also involving gorilla. This was just for physicians, experts in radiology. Here is better picture. Radiologists. So they received the X-ray picture that was a little bit remade or manipulated. And there were small gorilla pictures inside this X-ray picture. They were quite large because they were 45 times larger than the cancer nodule that was also manufactured in the picture. So those experts, specialists, were asked to find those nodules. So they were just focused on finding the cancer, so they overlooked much bigger picture of gorilla. Over 80% of specialists overlooked that. Okay, so that's the conclusion. Autism and the memory. We are not going to continue with the memory. I just want to introduce you to something that also belongs to the basic brain knowledge. So it's good to know something. You remember the film Rain Man and the Dustin Hoffman who played the role of this autistic fellow. But this was a specific case of autism. The model person who was played by Dustin Hoffman, by the actor, was a real person, Kim Peek. He was a real Rain Man, autistic fellow who was a savant. Savant is a person or savant syndrome, or people having savant syndrome. That's persons with so-called developmental delays. They have mostly Down syndrome, but sometimes after brain injury. But they demonstrate some exceptional capabilities far in excess of those considered normal. For example, fantastic memory. That was the case of Kim Peek. Memorizing. During his life, he read around 10,000 books. 10,000 books. And he remembered everything, line after line of the text of those 10,000 books. That's savant. That's all about the savant syndrome, like that. We know that brain must remember, but brain must also forget, and it forgets because of different reasons. We don't stimulate it, we don't exercise, we lose connections, we whatever. So what are capacities of our memories? Another case, as important as Phineas Gage case, Henry Molaison, who was the patient suffering from amnesia. What happened? He suffered from intractable seizures, epilepsy. It was impossible at that time to treat him pharmacologically. No pharmacology helped him. So the only way was to remove a part of temporal cortex. So they did, but unfortunately they made the mistake and they took too much tissue. So they removed amygdala and hippocampus. And again, this is the first documented human case where the function of hippocampus has been studied in so detail. So he experienced amnesia. So this was the evidence that hippocampus is involved in formation of memory traces. That's it. I just wanted to mention this. Henry Molaison, you may read some stories about him. It's a lot on the internet, of course. So what we can do when we have a list of words and we try to memorize them, so the magic number is 7 plus minus 2 words. Please do not try to convince me that you are not prepared for the test or you failed the test because you were able to memorize 7 plus minus 2. Okay? It doesn't work like that. It's only short memory, 7 plus minus 2. So the longer list will be forgotten or is not possible to be memorized in a moment, in a short time, without rehearsal, of course. We have some other people with extremely good memory. For example, Daniel Tammet, he's still alive. He has some programs, sometimes interviews in TV programs like that. So he is able to memorize like over 22,000 decimal digits of P number. Okay, some other, you have those examples uploaded. Earliest Shereshevsky, etc. Other savants suffering from autism, so I thought Down syndrome, it's autism, not Down syndrome, of course. There are not only memory skills, there are also other skills as well. So that's, for example, drawing skills. And you can see the Nadia, the 5-year-old savant, then in the middle, Leonardo da Vinci, who wasn't a savant, and the, let's say, old 8-year-old child, which doesn't have those savant properties or features. Maybe what is contributing to the excellent memory is synesthesia, the unification of different senses, like, for example, colors and tones and numbers. So the two sensory, it might be multisensory synesthesia. Here I talk about two sensory stimulation of one sense or one modality triggers perception in another. So, for example, stimulation of color triggers stimulation of memorizing numbers, like that. So here you see examples. Sound triggers color, smell triggers color, sound triggers body position, etc., etc. And synesthesia may contribute to creativity. What statistics says that synesthesia among artists is statistically higher than among, let's say, normal people, 7 versus 2%. Maybe that's the reason that artists are, let's say, better performing in some tasks. And synesthesia does not have to be identical among all people like that. Here you see, for example, Isaac Newton was synesthetic as well, and the tones can differ, are not related to the same colors, for example. Okay. We're coming back to the problem that I talked about, I mentioned only when talking about those rearrangements of connections between neurons. So where our memories are stored, is there any space, selected space limited space in our brain, area in our brain, where all memories are stored. This idea would be nice because it's much easier to take the memory trace out of the limited space in the brain, but it doesn't work like that. We have a hypothesis, which is now proved, that cells that fire together, that means neurons that are activated at the same time upon the same stimulus, will be linked together, will be wired together, forming connection or connections. And the second conclusion coming out from this is that memories are stored where they are or were initiated. That means where those synaptic connections were formed, this will be the site of the storage of memory, of particular memory. When this link between those neurons vanishes, so the memory trace does as well. This is very important because this means also that the memory is not located in a particular area of the brain. It's everywhere. So now we have to change our definition of a synapse, because we knew synapse is a link between two neurons, okay, and one presynaptic synapse will release the neurotransmitter, which will be detected by receptors at the brain membrane of the second postsynaptic synapse. So that's a link using chemical communication. No, it's not sufficient to define the synapse, because now besides the site of communication is also the site of memory formation and storage. It's very important here. And now, identification of concepts. We learn. Mostly we learn from or by observation. When you go to the patient's room, you learn how to listen the heartbeats, okay, how to measure the blood pressure. You learn by observation. You learn a lot during biochemistry lab. You learned how to pipette and whatever else. But here we have something that we have to figure out somehow, creativity. We have to use our creativity. Are we capable of doing so? Okay, we see pliers. We see pliers, we know what they are for the tools, how to use them. But those two other tools or devices, we have to learn somehow. We have to look at that, what they can be useful for. Here it is. So now we can use our creativity to use those tools for another applications, for example. So learning is mostly coming from observations, not all learning, but majority of learning, as you know, from autopsy. Okay, we have something funny here. Stupidity gene, which is of course coined Homer Simpson gene, the most stupid fellow in the world. And you see, this is a gene which is a natural suppressor of synaptic plasticity, mostly in hippocampus, which is involved in learning and memory. So that means that this gene doesn't allow us to learn too much, to overheat the brain. Again, please don't try to convince me that you all have the stupidity gene, because we all have it. and you were unable to learn for the test in neuroscience, for example. It doesn't work that way. So please don't. Oops, sorry. And also a beauty. The beauty is very important. Why? We'll slowly approach that. It's not only the feature of humans, it's also in the animal world. We have so called bowerbirds that make their nests in a beautiful way just to attract the female. So the beauty is not recognized exclusively by humans. Our perceiving of the beauty may vary, and it really does. Here is a Goya's painting. Goya is very famous, or was very famous artist, of course. We honor his art as well, but sometimes we may have some, different points of view and some hesitations. From one side, this is Goya, must be good or excellent. From the other point of view, it's ugly. Okay, it's Saturnus just eating up his one of his sons, just in to protect himself between being killed by the sons. This was the prophet that was saying that. So we have this duality like that. Some of us will like it, some of us will dislike it. So we have somewhere the feelings, what is beauty, what is not. Another picture, painting. Morning with a wild red deer. These so-called landschafts are well known everywhere. The deers on the field, it's something that we start laughing like that. But this is Samuel John Carter, one of the best painters in the world, and definitely one of the top painters of England. And this painting, this picture, is in the Tate Gallery in London. So Tate Gallery does not put anything below the absolutely best top level on the wall like that. And again, we may have hesitations. Is it nice or not nice like that? So what is the meaning of this beauty or not beauty? First of all, adaptation, because it helps to select a partner. You remember the bowerbird. But it also works in the human world. This is also important for social interactions. We dislike those people, we like those people, we don't love these people, we love those people. And to express emotions. And emotions we show will be perceived by others. So by showing emotions, we let them know how do we feel about something, what happens. Okay. Now we switch to neurotransmitters again. This was just for your general knowledge. We have those neurotransmitters. We mentioned some serotonin. We mentioned GABA. We mentioned the glutamate. GABA, you remember, major inhibitory. Glutamate, major stimulatory or excitatory. The very important balance between inhibitory and excitatory or stimulatory neurotransmitters, and imbalance between glutamate and GABA may lead to epilepsy, for example, to seizures like that. So the balance is extremely important here. But that's classical neurotransmitters. You know them very well, so I am not going into details because that's not the topic of this presentation. What is the topic here, and we'll only touch this today because we are approaching slowly the end of this lecture, are unconventional neurotransmitters. Very important which are mostly overlooked among students because you have enough work to memorize those classical neurotransmitters, and suddenly you get something completely novel knowledge. Because indeed, the knowledge is relatively new. It's not very new, but it's not as old as the knowledge about classical neurotransmitters. Gases. So, for the first time, we learn that a gas can act as neurotransmitter, as a messenger. Nitric oxide. We know that this is toxic, but not at such small concentrations. It does not have any receptors like classical neurotransmitter. You remember, there are specific receptors for serotonin, for glutamate, for GABA, for whatever, NMDA, whatever else, but not for such gases. It diffuses through the postsynaptic membrane to activate guanylyl cyclase. This is, sorry, guanylyl cyclase, with all consequences how it works later. Is involved in learning and memory. Please do not try to breathe nitric oxide, at least not this one. It's not a laughing gas. Laughing gas is N2O, which is not the same. But we can stimulate this nitric oxide because Viagra and all sildenafil citrate analogs, which act in a similar way to Viagra, they will also stimulate nitric oxide. But that's completely another story. ATP is also a messenger. It produces, besides ATP, it's an energy currency, you know that. It produces also fast excitation. Nitric oxide we know, and another toxic gas, carbon monoxide. Major regulator of cyclic GMP in the brain. So suddenly we find ourselves in a completely new world of some substances that have never been taken into consideration. Okay. Nitric oxide, you have this uploaded on the server, so I am not going to focus too much about that. But the last sentence interacts between neurons that are not connected by synapses. So it can just connect neurons without even synaptic connection. So we have an extra possibility of the brain to transmit signals without synaptic connections or besides synaptic connections. It has been described, well, quite a long time ago, 1979, by Professor Moncada, very, very distinguished fellow, who has been denied the Nobel Prize. He didn't get it, despite the fact that he was first who discovered it as a neurotransmitter. So he was really upset. I listened to one of his lectures. He's excellent speaker as well, but he was really upset of this, so he was just omitted from the Nobel Prize. Okay. So at that time, he was just struggling because he isolated this nitric oxide from the nervous system, and he couldn't identify it. because he never expected or he never predicted that this will be a gas. He was looking for a chemical substance, chemical structure like a classical neurotransmitter. So just fixing himself, fixing his ideas on something completely different did not allow him to go further. It's also a good lesson to all of us. So it was the first gas known to act as a biological messenger, in a gas form. The synthesis is like the stimulation by Viagra. The arginine, then its arginine will be converted, its metabolite, the endogenous metabolite is citrulline. And this is just the nitric oxide that will be just released during this reaction. And we have nitric oxide synthetase, the enzyme catalyzing this reaction, which is not the only one. You have this slide, so I am not going to talk about this. This is presynaptic neuron, postsynaptic neuron, and you see here that entire metabolism or arginine is just happening in the postsynaptic neuron here. And the role is quite broad of the nitric oxide in the nervous system, in circulation, in muscular system, in the immune system, and in digestive system. Okay, I will end up at this moment, and then we will continue with those unconventional neurotransmitters, and then we'll switch to the major topic, one of the major topics that will be neurodegeneration. Any questions? Yeah, I believe you're still there behind the camera. Okay. Thank you very much. Stay safe, stay healthy, and see you next week. How did they capture the images of the rat brains? You mean with nitric oxide or? Exercising the will? No, it was just performed anatomy, and that's it. It wasn't at that time. It was not that they made just the anatomy of the brain and made the microscopic multitasking help with creating more. Definitely, the more you stimulate your nervous system, the better for you. But remember the stupidity gene, which will not allow us to exceed certain level like that. Most probably, yes. Yes, that was like that with those poor rats. Okay, so thank you again. When spoke about the regeneration of neurons. What do you mean by TBI patients? Oh, traumatic brain injury. No, the traumatic brain injury, we will take it at the very end of this neurodegeneration when we will be talking about boxing and others such aggressive sports. The loss of the neurons in general in the entire brain cannot just, or in other words, the regeneration of neurons, if possible, will not overcome those losses in the neurons during TBI. So we cannot say it will help, but of course the possible therapy in general in the during brain injury using, for example, stem cells, implantation of stem cells might help somehow, but that's a story that is just beyond the today's the medical treatment. But people are working on the implantation of stem cells as well. Okay, that's it. So see you next week and stay healthy. Thank you very much.